Let me ask you something that sounds simple, but it changes everything. When was the last time you had a morning where your body felt automatic again? Not forced, not maybe it works, maybe it doesn't, just reliable. A lot of men over 60 quietly adapt to inconsistency. They don't complain, they don't talk about it. They just lower expectations and hope it improves on its own. But here's the twist. Your bathroom, yes, the same bathroom you walk into every morning, already contains two tools that can help you train the two systems that matter most for firmness: blood flow and nerve signaling. And it doesn't require tills. It doesn't require gadgets that cost hundreds of dollars. It doesn't require a 45-minute routine you'll quit next week. It takes about 4 minutes. And if you do it properly, you'll learn something important about your body, even if you never see a dramatic change. You'll learn what's actually missing: flow, signal, or both. Stay with me, because in the second half of this video, I'll also show you how to avoid the two mistakes that make this backfire, especially for men with blood pressure issues, diabetes, or prostate symptoms. I want to set a clear tone. This is not a fantasy video promising instant rock-hard results. Anyone who sells guaranteed outcomes for every man is either exaggerating or ignoring medical reality. Instead, think of today as a training session for two parts of your system that often decline with age: vascular response, how quickly blood vessels can open and deliver blood where it's needed; and neuromuscular activation, how well nerves and pelvic muscles respond to arousal signals and maintain firmness. If you're over 60, you already know this isn't just about desire. You can want it badly and still feel like your body is half a second behind. That half second behind is usually one of three things: blood isn't arriving fast enough, nerve signals are dulled or delayed, or the pelvic floor isn't coordinating well enough to support and maintain pressure. So what we'll do today is simple. We'll train the vessels and wake up the signal using two common bathroom items. Let's get real about why erections change with age. Without shame, without panic. Aging doesn't flip a switch. It turns dials. Blood vessels become less responsive over time, especially if you sit a lot, sleep poorly, or have insulin resistance. The lining inside the vessels, the endothelium, can get sluggish, meaning it doesn't release relaxation signals as efficiently. Nerves can become less sensitive, especially with long-term stress, back-hip tightness, or metabolic issues like diabetes. Pelvic muscles can get either weak or overly tight. Here's the part most men miss. Tight doesn't mean strong. A clenched muscle can be exhausted and uncoordinated. And then there's the silent factor no one wants to talk about: anxiety feedback. If you've had a few inconsistent experiences, the brain starts scanning for danger. That activates stress hormones. Stress hormones redirect blood away from non-essential systems. That makes inconsistency more likely. So the question becomes, how do we interrupt the loop in a way that's simple enough to do daily? My answer: train the body in a calm setting, like your morning routine, where there's no performance pressure. Here's the framework I want you to remember. Firmness equals flow plus signal plus support. Flow means blood gets there. Signal means nerves fire and communicate. Support means pelvic floor coordination helps maintain pressure. Our two bathroom tools target flow and signal support. Object number 1, the shower head for flow and vascular training. We're going to use temperature contrast, not as a magic hack, but as a way to practice vascular flexibility. Warm water tends to encourage vessels near the surface to open up. Cooler water encourages them to tighten. Alternating can act like a gentle workout for vascular responsiveness. Important safety notes before you try this. If you have unstable heart issues, uncontrolled high blood pressure, fainting episodes, or you feel unwell with cold exposure, skip the cold contrast and use warm only. If you have neuropathy, numbness, be cautious with temperature extremes because you may not sense discomfort properly. Never use ice cold until it hurts. This is not punishment, it's training. Now, let's do it. Step by step, start your shower normally. Use your usual comfortable warm temperature. Position the spray so it targets the lower abdomen and pelvic front, the zone roughly between the belly button and pubic bone. You're not trying to hit the genitals directly. You're targeting the region that relates to pelvic circulation and the supply routes. Keep the shower head a comfortable distance away, close enough to feel pressure, not so close it irritates the skin. Warm phase, 30 seconds, slow circles across the lower abdomen. Breathe normally. Keep your shoulders relaxed. Cool phase, 20 to 30 seconds. Switch to cool, not freezing. You should feel a clear change, but you shouldn't be gasping or tensing your whole body. If you tense up hard, you're training stress, not training blood vessels. The goal is calm exposure. Go back to warm for 30 seconds. Repeat for 3 rounds. That's it. What you're trying to accomplish. Not instant arousal. A daily practice that improves how quickly your system can shift from constriction to dilation smoothly. Bonus upgrade, optional, new insight. If you're comfortable, you can include upper inner thighs during the warm phase, just briefly. That area is often tight and undercirculated in sedentary men, and loosening it can support pelvic comfort and mobility. Let's talk about expectations like adults. If temperature contrast helps you, you'll usually notice one of these first. Better morning readiness, not necessarily daily, but more often. A stronger sense of warmth or circulation in the pelvic region after the shower. Improved responsiveness rather than pure hardness, meaning the body reacts more easily when the mind is willing. But if you do this and feel nothing, don't assume it failed. It may mean your main limiting factor is not vascular. It could be nerve signaling, pelvic tension, medication, or blood sugar issues. That's why we pair it with the second object. Now for the second tool, vibration. The original concept floating around online is using a dedicated electric toothbrush with hygiene precautions to deliver vibration to the perineum, the area between the testicles and anus, because it sits in your pelvic floor structures and nerve pathways involved in arousal response. I'm going to present this in a safer, more practical way. You can use an electric toothbrush only if you keep it dedicated and clean, and you use the smooth back, not the bristles. But honestly, a small body-safe vibration device designed for external massage is more hygienic and easier to clean. Not an adult product pitch, just basic practicality. Either way, the method is the same. Gentle external vibration to wake up the signal. Why vibration can matter? New analysis. Vibration provides sensory input. Sensory input can improve brain-body signaling, especially when sensation feels muted. It can also encourage better awareness of pelvic tension. Many men are unknowingly clenched all day. Safety notes: if you have pain, inflammation, or skin irritation, don't do this. If you have numbness or nerve problems, start very gently and stop if anything feels wrong. Never press hard enough to cause pain or bruising. More pressure is not more benefit. Timing: after the shower, when tissue is warm and relaxed. Wash your hands. If you're using an electric toothbrush, make sure it's dedicated and clean. Again, do not use your toothbrush head. Hygiene matters. Sit or stand in a relaxed position. Place the smooth backside of the vibrating device against the perineum area, gently. Hold for 45 to 60 seconds at a moderate vibration setting. During the minute, do this one thing most men skip. Breathe out longer than you breathe in. Example: inhale 3 seconds, exhale 5 seconds. This is not spiritual. It's nervous system mechanics. A longer exhale helps shift the body away from stress mode. Now, here's where I'm going to add a piece that most short videos don't explain. A lot of men think the pelvic floor is either weak or strong, but the real issue is often coordination. If you're clenched all day, tight hips, tight lower back, shallow breathing, your pelvic floor can become like a fist that never relaxes. And a fist that never relaxes is not powerful, it's fatigued. So after the vibration minute, try this 30-second reset. Inhale gently. As you exhale, imagine your pelvic floor dropping and softening, not pushing, not bearing down, just releasing tension. Repeat 4 to 5 breaths. This teaches your system safe, relaxed, responsive. Here's the full routine. In the shower, 3 minutes, warm 30 seconds, cool 20 to 30 seconds. Repeat 3 cycles. Keep your body relaxed. After the shower, 1 to 1.5 minutes. Vibration on perineum, 45 to 60 seconds. Then 30 seconds of slow exhale breathing plus pelvic release. Total, roughly 4 minutes. Notice what I did. I didn't claim this forces erections. I said it trains the systems that contribute to them. That framing matters because training implies consistency, and it implies your body adapts over time. If you want to know whether this is helping, don't rely on one morning. Track 3 signals over 10 days. Morning readiness frequency. How often you wake up feeling some firmness. Response speed. When aroused, does your body respond faster than before? Staying comfort. Does it feel easier to maintain without strain? Also track this. Do you feel calmer about the topic? Because anxiety reduction is not a side benefit. It's a main mechanism. If you get calmer, your body stays in a state where blood can go where it needs to go. Let me save you time by calling out the 2 mistakes. Mistake 1, making the cold phase extreme. If you shot your body into panic, you trigger stress response, narrows vessels, and tightens muscles. If you're gasping and bracing, reduce the cold intensity. You want cool and controlled, not survival mode. Mistake number 2, pressing too hard with vibration. This is not deep tissue. This is sensory activation. Too much pressure can irritate tissue and make you avoid the routine altogether. I need to say something that may be the most important part of this entire video. Persistent erectile dysfunction can be a warning light, not a shame signal, a health signal. Sometimes it's about blood pressure, blood sugar, sleep apnea, medication side effects including some blood pressure meds, antidepressants, and others. Low testosterone, not always, but sometimes, depression and chronic stress, prostate issues, and urinary symptoms. So if your erections changed rapidly, or you have chest pain, shortness of breath, leg pain when walking, or sudden loss of function, don't just try hacks. Talk to a professional. This routine is a supportive practice, not a substitute for medical evaluation. If you want to amplify the results without adding much time, pick one of these for the next 2 weeks. 10-minute walk after dinner. Improves blood sugar handling and circulation. Hydration timing. Drink more earlier in the day, less late night. Supports sleep quality. Leg strength twice per week. Squats to chair, step-ups, or light resistance. Legs are a circulation engine. These upgrades aren't sexy, but they're powerful. So here's your simple plan. Tomorrow morning, don't try to perform. Don't test yourself. Just run the routine like an experiment. 3 minutes of controlled warm, cool contrast in the shower. 1 minute of gentle vibration plus calm exhale breathing afterward. Repeat for 10 days. And pay attention to what shifts first. Warmth, responsiveness, confidence, or morning readiness. Because when men improve, it's often not one dramatic moment. It's a quiet return of reliability. If you want, drop a comment with just one word, reset. It tells me you're actually trying it, so I can make a follow-up video on the most common questions: temperature level, where to aim, and what to do if you have diabetes, prostate symptoms, or high blood pressure. And in the next video, we'll connect this morning routine to something even more effective long-term: how to restore pelvic mobility and calm the nervous system so your body stops bracing when it's supposed to relax. Because the real goal isn't a trick. It's getting your body back on your side. See you in the next one.